All right. So first of all, Karina, I'd like to thank you for accepting to do this. This is going to help doctors and patients to realize what Dr. Smith just did is no longer the surgery people think it is, and the surgery people are afraid of. Okay. So having said that, I'll leave the word to you and to Dr. Smith to kind of share both perspective, the patient and the doctor, and in this teaching environment that it is. And again, I want to thank both of you to allow me to share this to other doctors and patients. Yeah. All right, all yours.
Well, for one, I'm super glad I had the opportunity to do this. I was really excited about it, and I think I said earlier the most pain I had was the leg cramp, when my leg cramped up in the chair. But other than that, like super easy, no pain. Like I have no pain. It wasn't. I think a root canal might be even more. You hear all of the noise. There
That's
really
right.
wasn't a whole lot of.
That's right.
Like kind of noise that you hear. So super easy, and he did great. So.
Wow, thank you for first of all I know you trust Dr. John,
Yeah.
but to allow him to do these cases in this teaching environment is wonderful, you know, and it does take trust though. It just like anything else, it does take the patient trust the doctor, and the doctor needs to earn it.
Yeah.
So having said that, Dr. Smith, tell us about what you did and how you feel as a doctor and how you relate to your patient here. Who just shared her feelings.
So Karina came to my practice. She needed a new crown, but in order to do a new crown, we had to X-ray the health of her tooth, and we found that she had 2 failed root canals with large infections, and we were unable to do the crown. So rather than remove her teeth, we knew it was possible to do surgical endodontics with laser therapy, and that would have minimal discomfort. And so I knew about this treatment, and so I made her aware of it, and we were able to do it through this training. And the procedure went very well, didn't take very long, and now she can get her new crowns.
So the new house can be built, right? Yeah. On this foundation that just got taken care of. You were about to say something, Karina, or you were just concurring.
He said it was with minimal discomfort, and I would say there really wasn't really any discomfort. So it was pretty exciting. And you're right, it does take a lot of trust, but I also have a lot of confidence, and I had no idea that such a thing would exist in your mouth, that you could have an infection in your tooth, and then the other thing of even knowing that you would be able to fix it without pulling it. So I was super excited to be a part of this. So thank you.
Oh, thank you. It does take a team to make things possible. You know that, you know.
Yeah.
And right here we have the doctor and the patient forming a team. Now, John, you if you could share what we found in the CBCT and how you changed the treatment plan and informed Karina, and then you carried on, right? So what was the original treatment plan, and what's the what you did eventually?
We were aware of a large infection on the mesiobuccal root of number 3, but without the CBCT, that's all we were aware of. But then with the CBCT, we found a root tip fractured off on the distal buccal root of number 3, and then number 4 had some periapical infection that showed up on a 3D scan, and so we were able to fix all of those in the same area together, and so now the infection's gone, and she's going to enjoy having teeth.
Absolutely. Having body parts that didn't get taken out, right?
Yeah.
I mean, dentists don't realize it, but they are taking body parts and throwing them away, which is, I think, is crazy. Now, what about 15? So you saw also something on 15, but then your treatment planned that differently, right?
And so, yeah, the other tooth.
I mean, not 15, 2. I'm sorry, 2.
Number 2. Also, we noticed some lack of seal on number 2, and we're going to proceed with conventional retreatment endodontics on that too.
Beautiful, beautiful. So let me chime in. You asked me earlier, Karina, about, or we discussed about it, you know, about what to expect.
Yeah.
So tonight you probably have a 5 to 7 out of 10, you know,
Yeah.
and some ibuprofen that we're gonna get you before you leave.
Yeah.
Will probably take care of it, you
Yeah.
know. And then the goal is to have a good night of sleep. And tomorrow morning, if you can track this for Dr. Smith and tell him when you see him on Tuesday,
Yeah.
you know, what the level of pain would be on, you know, as soon as you open your eyes,
Yeah.
what it is
Yeah.
without medication. And maybe before you go to bed tonight is to track the level of pain and tell him
Yeah.
so that he can also realize, because he's, I mean, I've done this for a long, long time. Dr. Smith has done some of these, but he needs to hear from his patients to know that his patients are taken care of.
Yeah.
And that's very important. I know he believes that you not have pain, but he needs to hear it so that he won't have no doubt that he's rendering an awesome service to all his patients, you
Yeah.
know. And that is the beauty of healing with the laser and so forth.
Yeah.
And then the healing of the bone, that's going to be in about 2 to 3 months. You know, he can check that and maybe he'll do another scan to compare. Okay?
Yeah.
Go team. I can only say this. Go team. And you
Yeah.
know, this is, we need to change the face of dentistry and of endodontics. We can no longer have fear and pulling teeth. That's no longer acceptable in 2019. Not acceptable.
Yeah.
Right?
Agreed.
All right, here's my thumbs up. Can you show me yours? There you go. Thank you very much.